mitochondrial donation treatment, mitochondrial replacement therapy, 3-parent IVF or 3-parent baby. All are same things that we are talking about. What is mitochondrial donation treatment? So, it is a technique developed by researchers and scientists.
Doctors have taken DNA from the eggs of two women to create a hybrid egg that was fertilised with a man's sperm. So why did they do it? The vast majority of genetic information is transferred through the nucleus of the egg cell, but a small amount is also passed on through what's known as mitochondrial DNA, which comes from the mother. In this case, the mother had mutations in her mitochondrial DNA, which meant she could have passed on a fatal genetic disorder to her child. 2 of her children did inherit it and died. The couple, who are from Jordan, wanted to have their own healthy baby, so they turned to doctors in New York for help. Using a technique called spindle nuclear transfer, the doctors took the mother's healthy egg nucleus and combined it with the mitochondrial DNA from a donor egg. They then took the sperm from the father and went ahead with the normal IVF process. And 9 months on, the mother gave birth to a healthy boy. The baby has less than 1% of his mother's gene mutation.
Basically, an advanced IVF technique. What it ensures that a baby will inherit a healthy mitochondria along with the genes of biological parents. So this is the main aim. Then how it has to be done? Genetic material from donor egg is removed and the genetic material of biological parents is added. Only the mitochondria of a donor is remain along with the genetic components of both parents. So basically, a embryo is created having the genes of biological parents but mitochondria of donor side. There are 2 ways to carry out mitochondrial donation treatment. First one is maternal spindle transfer and the other one is pronucleus transfer. What happened in both, the basic procedure is same. That means biological genetic material of biological parents must come and the healthy mitochondria from the donor side must have to come. In maternal spindle transfer, the genetic material from the mother's egg is removed and transferred into the donor side. But the thing here to mention is that from the donor egg we already have removed the genetic material. Only mitochondria is there. So the genetic material from biological mother is added into donor's egg in which mitochondria is already present. Now the donor egg, which contain the biological material from mother's side and a healthy mitochondria from donor side, is now fertilized with the male gamete, that is from biological father, and now embryo is developed in lab itself. In pronuclear transfer technique, what happen is the embryo genetic material, that is embryo which is created from biological mother and father. From here, the genetic material, that is nucleus, is removed from this embryo and transferred to the embryo of donor side, that is from donor and the sperm provider. An embryo and another embryo is getting ready, from which the genetic material of this embryo is removed and the genetic material of biological father and mother is added to this donor side embryo. So this happen in pronuclear transfer technique. The thing here to note down is in both of the techniques that I have mentioned above, the genetic material of only biological parents are involved from both mother and father side, and a healthy mitochondria from donor side is included, but no genetic material from donor side is included. Only healthy mitochondria is included.